So here we are. We're doing the Wired for Change podcast on site today. And here we are in Vancouver, and it's beautiful here. And we're at the National Health Tech Innovation Conference. And I'm joined by Dr. Matthew Bromwich from CHEO. And you're a surgeon there.
Correct.
And you have been running like this whole day, really. It's a 2-day affair. And maybe you can tell us a little bit about how this came together.
Sure.
What we're doing today.
I'll give you the brief origin story.
Please.
Which is in 2005, I had invented a medical device. And I went to my hospital and said, I invented a device to cure the most common cause of dizziness in 3 minutes without side effects. I've done 5 prospective clinical trials on it, and it works great. And they said, congratulations. And I said, great, what do we do? And they're like, oh, we don't do that here. And then I was like, well, why did I do any of that if we're not going to do anything with it? And that was really the origin story, because honestly, I was mad about that for about a decade.
I would laugh when you say that.
Yeah. And,
I'm sorry, maybe I shouldn't laugh.
No, it's okay. But I came to terms with it because I think they were actually right. They don't do it there, but they didn't say where you do it. And so the journey for me has been pulling together the places that you do it, which means bringing ideas out of healthcare, bringing them through the R&D environment, bringing them through the business environment, and then bringing them back to healthcare. And that requires a numbers of bridges, a numbers of people, speaking different languages, learning different processes. And it's not easy to do. And so today and tomorrow's conference is primarily about solving 2 aspects of that, which is about 1, procurement. How does the hospital support this? By buying the things that are made by its own physicians and research teams. And funding, which is how do you solve the valley of death, which is the period of time after you've finished your publicly funded research, but before you've got into the privately remunerative purchasing of it, you're in a valley of death. And essentially there's 4 things that help you there. Is the 1, money, experience, speed, and those are all modified by complexity. So if you're doing something hard, it takes longer. If you're going fast, it takes less money. If you have experience, it takes less money. Or if you have a lot of money, you don't need to go fast, don't need experience, and you can do something hard. But you can't have all of them. So trying to figure that out is part of tomorrow's work on funding.
Wow. That was very well articulated. How widespread do you see these challenges as being? Like, is this a Canadian thing? Is this a healthcare thing? Is it an Ontario thing?
I think it actually happens in every industry. So if you look in law, for example, there are people who do innovation in law but don't have the business skill sets. It happens everywhere. If you look in law, for example, they try and innovate, but they don't have the business skills necessarily. So any technical founder in any industry, we're talking about medicine, but anything would have the same problem. And for me, really, this journey is about not teaching doctors how to do business and get MBAs, but having doctors meet business and meet MBAs and teaching them how to work together. Because really it's that collaboration gap which causes this problem. And if we just could trust each other and learn how to communicate with a translator maybe, because I talk about patient outcomes and they talk about ROI, and neither of us knows what the other person is talking about. And so that's a serious problem that every industry would have.
You got into a question that I was going to ask you actually about cross-functionality and different skill sets coming together and where you've seen that successful. So have you actually seen that come together successfully?
You know, I think the only time it actually works is when you have the unicorn person who speaks all languages and can navigate that, either through serial failure where they learn the other language and they're like, oh, and I'm just going to liken it to traveling since we're talking about languages, is that if you go to, I don't know, medieval France and you don't speak French and you don't have a map, it's going to be difficult, but eventually you will learn French and you will learn your way around. But had you had a translator and a map, that would have been an easier journey. It is exactly the same. And so you can learn the skills. It just takes longer and is harder.
Right. You took a bit of an unconventional approach today to the discussion, which I really loved.
Okay.
In terms of you had a keynote speaker, and then you had small group kind of discussion, and then you had a panel, and you had it all kind of come together. What was some of the thinking behind that? And do you feel like it was effective?
Honestly, I was kind of nervous about could we pull this off, but everyone's been to conferences where you have a lot of talking heads, and I think people reject most of what they hear because it doesn't agree with them. But if we literally formed the opinions together, I think everyone has no choice but to accept the outcome. And so that was really the driving force, is how do we build consensus across this diverse group of business people, researchers, healthcare workers, and government? How do we get them all to agree such that we can create a plan or a blueprint for what are we going to do in the next year? So that was our thesis. How do we achieve that? The keynote sets the stage, maybe gives you an example. This is the problem. These working groups is, we don't know, you solve the problem. And then trying to bring it together with a debate and just highlighting things that come up, I think highlights the nobody's really at fault individually. Everyone has something to say. It's kind of confrontational, but brings out the different things. Go back to your tables, align and agree amongst yourselves. And then we'll read back to you what we heard, which was hard to summarize.
That was incredible. Just so that people know, you had a recorder, like a person typing notes at every table, and the discussions, like at least at my table, were everywhere, very on point, but still it was a meandering path to get there. And then you somehow captured all of that and then played it back into a set of slides and visuals that were actually pretty good.
Yeah, I enjoyed the fact that the presenter, Harvey, had never seen the slides before.
That was amazing.
And I think that led to a certain amount of anxiety for everybody, but we all experienced that together. And I think that's part of the magic of this conference, which is let's create the answers and experience the discovery of those solutions together.
It was kind of a journey that we took that ended up at the end of the day in building some consensus in a very rapid iteration kind of way, which I really liked, starting with that poignant story that an entrepreneur told at the beginning in terms of his challenges in finding funding and going back to the US and back here and all over the place. And what was the analogy about the tree? Tell us the tree thing.
The tree. Well, I've never actually used that analogy before. It's like the school of hard knocks. We called it the failure tree or something, or basically it's the ugly tree. So if you hit every branch, you have a lot of experience, but it leaves its mark. And in innovation, being experienced just means you failed a lot. And I think this is a real problem that people want the unicorns. The institutions are like, Matt, deliver us more unicorns. And you cannot promise that we're going to do that. I have 100 ponies. Wouldn't you like a pony versus nothing? Because I'm not going to give you a unicorn very often. No. But without any ponies, you will have no unicorns. And if you just turn down the ponies, you will have nothing. And so I think it's
Was that the birth of another analogy?
Yeah, it goes somewhere dark, so we'll stay away from that. But yeah.
Okay, wow, that was great. And then a little bit about your background maybe and how you became an entrepreneur. Have you always been entrepreneurial at heart?
I think I've always been frustrated at heart with the status quo, which leads the only option of do it yourself, which is, I guess, entrepreneurial thinking. It's not accepting the status quo. So I guess I've always been trying to solve these kinds of problems. So 2005, I launched my first company, which was DizzyFix, to solve a common cause of dizziness that honestly was just annoying. Mm-hmm. And I wanted to do something about it and didn't know how, and hit every branch in this failure tree, or whatever you want to call it. But learned a lot, did it again and again and again, and did 5 medical devices, the most successful of which was Shoebox. Had 110 people, had a big exit to an international company, and it was great, but also highlighted the failure points across the entire system. And so eventually I came to the thinking of we could solve this. It's just that there's a problem here, 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 and I mapped it out. Mm-hmm. You saw the map today. Yeah. And I liken it to a suspension bridge, which you can have all the effort of building a suspension bridge. But if you don't put one link in, any link, anywhere, if you miss one link, it all fails. Mm-hmm. And that's our problem. And trying to get everybody together to identify every step that needs to function properly for this to work is a lot of effort. So I'm really glad that we have all the people, we have all the right people.
We do. Was that intentional? Did you guys handpick people?
Yes.
Oh.
Yeah.
Well,
and again, it was a lot of work.
I got an invitation. It was a lot of work to do that.
It was a lot of work.
But you guys have good networks.
To harangue the right people into the room, because we really need them. And I said that several times during the conference. We're not talking heads up here. We need the people here to help solve their problem. It's eminently solvable. It just requires hard work, agreement, and then persistence.
Nice. Any key takeaways from you from what was summarized at the end of the day and the magical presentation that came out of nowhere?
I think when we started off with Sean Mondeau, the innovator talk, and several people said it early, is that The unfortunate thing is you don't know what you don't know at the beginning. So you don't know what questions to ask to solve the problem of your path is going in the wrong direction. And so what I would suggest is seek advice early. And a lot of people are worried. They're like, oh, I don't want to share my idea in case you steal it. I think that's the wrong approach. I share my ideas with as many people as possible early, and they're like, oh, you could do that, but you'll find that this will happen and that will happen, and you'll learn that yourself, I guess, or you could just take my word for it. And so you're like, oh, I'm going to pivot a little bit and go this way. How does that sound? And you kind of check in with your business person. You check in with your research. Is that technically feasible? Will a laser do that? They're like, yeah, lasers will do that. You're like, great, great, great. Can I sell that? Is that patented? And you kind of check continuously. And I think it shortens your path. So if I were to say one thing about the journey that we talked is find your advisors. You do not, and accept the fact you know nothing about what you're doing. Be humble, ask lots of questions. And at the end of the day, entrepreneurship is a lot about being the person that can tolerate more pain than somebody else. And that you can suffer the failures and the lessons and just keep going. And it doesn't mean you're stubborn or bullheaded. It just means you're persistent. Like, that didn't work, I learned, I moved. That didn't work, I learned, I moved, you know. Same as Edison and discovering the light bulb, you know. Just keep at it.
Well, a lot of determination is required for that kind of a path, and a lot of resilience, a lot of personal resilience,
Absolutely.
I think, as well.
Yeah.
Just last question, what are you looking forward to for tomorrow?
I think we picked two problems. We mentioned procurement and funding because they are the stickiest, because they involve other people. And you can't change other people generally. You can only change yourself. So we actually invited those other people to the conference to say, I tried to change you, that failed. Right. How would you change you, given that this thing? And so that's what I'm excited to hear is how would they, from the inside, change themselves to make this work? And then our strategy will be to take that information and teach it to everybody else in the similar thing, saying, I'm not telling you, your colleagues on the procurement side, in hospitals, in governments, say, this is how you solve the problem. Let us share that with you. And if you do that, we'll all have a functional ecosystem instead of a dysfunctional one.
Nice.
So that's the goal.
Having the right conversations.
Yeah.
Well, this is the perfect forum for that. So congratulations on creating that.
Thanks for having us. Thanks for coming.
I'm grateful to be here, really. So it's been a lot of fun, and I'm looking forward to tomorrow as well. There's a lot here in this, very brief podcast, I think, for folks in healthcare, but also broadly speaking for innovators and people who are trying to have an impact everywhere right now, because it's really a time of great change. So thanks for joining us today. Thank you, Matt.
You're welcome.
For joining us.
Any one of those people wants to reach out to us, coreinnovation.ca is our website. They can find us there and connect with further questions or offers of support and collaboration.
Amazing. Thanks so much. I've got a lot of change makers who listen to my podcast, so appreciate that.
Okay.
All right.
Thank
Take
you.
care. Thank you.